Hey everyone, it's Kresser. Welcome to another episode of Revolution Health Radio. Today I'm really excited to welcome Dr. Mark Hyman as a guest. Dr. Hyman's a practicing family physician, a 9-time #1 New York Times bestselling author, and an internationally recognized leader, speaker, educator, and advocate in the field of functional medicine. He's the director of the Cleveland Clinic Center for Functional Medicine. He's also the founder and medical director of the Ultra Wellness Center, chairman of the board of the Institute for Functional Medicine, a medical educator of the Huffington Post, and was a regular medical contributor on many television shows, including CBS This Morning, Today Show, CNN, and The View, Katie, and the Dr. Oz Show. I met Mark, I think it was maybe a year and a half ago at an event that we were both at in Arizona, and we immediately hit it off and became fast friends. He's an extremely intelligent person and one of the sweetest guys you'll ever meet. I have tremendous respect for his contribution in this field. He's a real inspiration for me and many other functional medicine practitioners. He's done probably more than anyone that I can think of to move the field of functional medicine forward and help it to gain the recognition that it deserves and so badly needs in order to become a greater part of the delivery of medical care in not only in the US, but around the world. And every time that I've had a chance to cross paths with Mark at other conferences or events that we were at, we've just had a great time together. And I was been wanting to get him on the show for a number of months, but because of our schedules, weren't able to make it work until today. So without further ado, I'd love to introduce you to Mark Hyman, and we're going to talk all about functional medicine and the future of medicine. So I hope you enjoy this interview as much as I did. Hey everyone, if you're like most people I know, you don't have the time or the desire or training for that matter to sift through the hundreds of medical studies that are published each month. But whether you're struggling with a chronic health problem or just want to maintain your health and live as long as possible, it's important to stay informed about the latest research and how it might affect your well-being. And let's face it, it's easy to get overwhelmed by all the conflicting stories in the media. You need a source of unbiased information that you can rely on, one that's easy to understand without too much jargon and full of practical tips that you can put into action. That's where my website, chriskresser.com, comes in. You'll find in-depth, evidence-based articles on a wide range of health and nutrition topics each week. You'll also find over 10 free ebooks on subjects like effortless weight loss, healing your gut, thyroid disorders, and natural skincare, as well as online classes and programs on optimizing nutrition for fertility and pregnancy and lowering your cholesterol without drugs. What you won't find is any third-party advertising, corporate influence, or hype-driven, headline-grabbing stories with a lot of drama but no substance. You just get the real inside scoop on the health issues that matter to you most. So head over to chriskresser.com and check it out. And when you sign up for my email newsletter, you'll get instant access to my award-winning 63-page ebook, 9 Steps to Perfect Health. It's like an instruction manual for preventing and reversing disease and living a long and healthy life. Okay, now back to the show. Mark, I'm so excited to have you on the show. I've wanted to do this for a long time, and I'm glad we could finally make it work.
I'm so glad to be here, Chris.
So I want to do something maybe a little different than the typical interview where we talk about nutrition and lifestyle and all that great stuff, which is really important. But I want to start by just learning a little bit more about your background and how you got to be where you are now. You're really well known in the functional medicine community, 9-time New York Times bestselling author, heading up the Cleveland Clinic's Functional Medicine Initiative. But I'm curious to know a little bit more about how you even got interested in all of this stuff. You were trained originally in conventional medicine, and how did you get from there in medical school to where you are today?
Well, I got there the way that no one really should get there, which is similar to your story, which is getting very sick and having to figure out how to get myself better when the conventional medical approach that I was expert in had no answers.
Right.
And it was through that exploration of the body from the inside out that I actually began to realize that everything I learned about how the body's organized, how we get sick, how we get better, how we define disease is all completely wrong. That, there's elements of what I learned that are the foundational science, but how the pieces got put together are just totally wrong and had actually nothing to do with how human biology is organized. And so through that exploration of my own illness, I began to sort of see what was out there. And I discovered Jeffrey Bland, I discovered Sidney Baker, Leo Gallen, guys like Russell Jaffe, pioneers in this field who really began to rethink our approach to disease and put together a story that turns out is actually probably the biggest medical discovery since, sanitation and antibiotics and vaccines. I think we just really have leapfrogged forward in medicine dramatically in the last few decades with the discovery of systems thinking and biology, and functional medicine is really the clinical application of all that.
So when you were getting started in all this, you mentioned discovering Jeffrey Bland. Was functional medicine even a term that was in use at that point, or was that still kind of evolving?
The Institute for Functional Medicine started in 25 years ago, whatever that was, probably 1990 maybe, or 91.
Yeah, 90.
And, they started putting on conferences, and, the first one I went to was in 97. Then I went to the first certification program, the AFMCP, and I began to sort of realize that I thought this was all a well-established field, but little did I know it was just getting figured out. And I was sort of figuring it out with everybody else. And, with the faculty that we built, we were able to really kind of come together and put together the basic foundational principles that have now become the Institute for Functional Medicine and the certification program, and, lay down the paradigm of a new way of thinking about how we get sick and better that is based on causes and not symptoms. It's based on treating the whole organism, not just organs. It's based on not geography, where is the problem in your body, but on the mechanisms underneath the symptoms. So that's what's really been exciting. And I got to try it on myself. I got to try it on, literally tens of thousands of patients, first at Canyon Ranch as the medical director, and then my own practice at the Ultra Wellness Center, and now at Cleveland Clinic, where we're launched the first academic medical center to have functional medicine in it, and it's just exploding there.
Yeah, I definitely want to come back to that and spend some time talking about it. This is probably a good segue into talking a little bit more about what some of the biggest problems are in conventional medicine today. I mean, you speak publicly about this. Your role at IFM and in the Cleveland Clinic, you're well acquainted with all of these challenges. But let's break it down a little bit. Like, where has conventional medicine really failed?
I think we failed in that we've focused on a system of classification of diseases based on symptoms and geography. Where is it in your body and what's a symptom? So if you have a joint pain, you go to the joint doctor. A head pain, you go to the head doctor. A stomach pain, you go to the stomach doctor. You got diabetes, you go to the diabetes doctor. But as we're learning about how the body works, this way of organizing thinking doesn't really work. And it's all it allows us to do is to group people according to symptoms, not causes, and then treat the symptoms with drugs that are usually suppressive and have a lot of side effects. So they block, inhibit, or interfere with some mechanism instead of learning how to create health. And so functional medicine is really the science of creating health as opposed to the science of treating diseases. And conventional medicine fails in that the model we have is great for acute illness, for, if you have a serious injury or acute end-stage problem, it's great. I mean, I'm at Cleveland Clinic, and absolutely I would go there if I had some serious acute problem. Right. But arguably, they're great at it. But what they're not great at is dealing with the burden of chronic disease, which now affects 1 in 2 Americans. It's 83.4% of our healthcare costs that are $3.8 trillion. And we are now recognizing that we don't have a good model to deal with this burden of chronic illness, everything from autoimmune diseases, which affect 80 million, diabetes, heart disease, cancers, digestive disorders, inflammatory disorders, skin disorders, mood disorders, cognitive disorders, depression. I mean, these things just are not well dealt with by our conventional approach.
Mm-hmm. And what do you find that there is a strong awareness of that, even within the deeper, more entrenched establishment within conventional medicine? Or are you seeing a change in the openness and awareness of this problem, or what's your experience with that?
Yeah, I mean, I think what's happening is that, science is catching up with everybody, and that the paradigm is beginning to crack. And as I got to Cleveland Clinic, I was sort of shocked to find some doctors saying to me, "What took you so long to get here?" Like, hurry up.
Yeah.
And one of them was Dr. Kara Singh, head of personalized genomics, and she's one of the leading genomic researchers in the world. And she's told me she's studying the microbiome and cancer, on how to regulate breast cancer. I mean, this is a radical idea. I mean, no oncologist is thinking about your gut flora,
right.
But she is. And Stan Hazen at Cleveland Clinic is looking at the role of our diet in regulating bacteria and how that affects your risk of heart disease. And that by altering your diet, you can change your gut flora and reduce your risk of heart disease. Again, nobody who's a cardiologist is thinking about your gut flora, but now these ideas are becoming almost mainstream, and things like leaky gut, which was a heresy years ago, now is all of a sudden written about in the medical literature as oh yeah, of course we always knew that. And so we're seeing these concepts of inflammation, for example, across all the specialties, like not just in autoimmune stuff and allergy and asthma, but in diabetes and heart disease, cancer,
depression
and dementia. I mean, who would have thought that depression is an inflammatory disease of the brain? We thought it was a psychological issue.
Yeah.
Like when we had ideas, for example, about autism, that it was from bad parenting, right?
Right.
And now we know it's not. It's a metabolic problem in the brain, called the metabolic encephalopathy. We know that depression may not be all the reasons we think people are depressed. There may be emotional issues. There may be something very physical. So. Obviously it can be emotional, but there are just different ways of thinking that are now emerging, so that anybody who's paying attention, who's a doctor or a scientist, can't avoid these ideas. And they're shaking up the very paradigm of what's going on. It's like, well, all of a sudden Einstein came up with a theory of relativity, and all of a sudden the world as we know it changed, even though people still don't really get his ideas even today. They really altered our view of reality, that time and space are not what we thought, that time is not linear, that space is curved, that, how could time not be linear? But it isn't, like that your solid objects are mostly empty space, that atoms are energy and not just matter. These are crazy ideas, right? And so the same thing is happening today in biology, and yet we're still, from a structural and a practice point of view, mired in this old system, and I think it's starting to crack in a big way, and I'm excited about what's happening.
Yeah, I'm really glad to hear you bring that up. When you were referring to research that's being done in the quote conventional world that supports functional medicine methodology, because one of the biggest criticisms that we hear from some people in the conventional world is that there isn't any research to support functional medicine. And I'd be curious to hear how you're addressing that challenge, both in terms of just redefining or reframing that question, or what kinds of research do support functional medicine, and then any specific initiatives that you are working on at the Cleveland Clinic to develop more research that could support functional medicine.
Yeah, so I think there are many, many scientists working in their silos on different aspects of what's happening. Guys like Dr. Alessio Fasano, who's been a pioneer in understanding gluten and the fact that there is a whole spectrum of gluten sensitivity, not just celiac, that it does cause leaky gut, and that it is related to a whole host of disorders that that aren't typically what we think of as gluten related. I mean, this guy's at Harvard, and you've got guys like David Lidwig, also at Harvard, who's shaking up ideas about calories, that all calories are not the same, that fat and carb calories act completely different in the body. And in his new book, Always Hungry, he talks about the fact that when you increase your fat in your diet, you shut off hunger, you boost your metabolism, you increase fat burning and reduce fat storage. Whereas if you eat refined sugars or carbs, you do the opposite. So these are really crazy ideas, that all calories are not the same. This is a heretical idea that contradicts our conventional worldview, but these are coming out of the highest levels of academic research. And then, there are guys like at Cleveland Clinic doing the studies on gut microbiome and heart disease. I mean, these are kind of like out there.
Yeah, and all of that, I mean, the important thing to realize here is those are not studies about quote functional medicine per se, but
No.
there's studies about discovering what the underlying roots of illness are and how to address it at that level, which of course is consistent with the functional medicine approach. And I think that's a really key point for people to understand. There's tons of research that supports functional medicine. It's just not called functional medicine research.
Right. So now what's changing is that for the first time in the history of the world, we're actually doing targeted functional medicine research, and Cleveland Clinic is funding literally millions of dollars of research. We've raised $8.5 million so far this year, and there's funding that's coming from the Cleveland Clinic directly to fund this research. And we're doing studies on reversing diabetes, getting people off insulin, on migraines, on asthma, on inflammatory bowel disease, and on autoimmune diseases. We just got a $5 million grant to study autoimmune disease, and we're going to be looking at really, some of the most sophisticated researchers in the field in psoriatic arthritis and other autoimmune diseases. So it's super exciting, and we're looking at dementia and working with the brain people. There's a whole program there called the Lou Rubo Center where they're focused on dementia research, but we were going to look at early on in the spectrum how we can actually treat the brain in a way that can lead to reversal of dementia. So I think we're really seeing exciting things happening. I'm working with one of the urologists who's just fanatic about functional medicine and nutrition, and we're doing a whole nutritional intervention with functional medicine to reverse prostate cancer, where we're actually looking at sophisticated genetic tests in the prostate cancer, because you can actually see changes quickly, and you can do biopsies before and after, so you can really get tissue easily, and it's a wonderful way to actually look at the effect of these interventions. So there's so much happening, and I wish I had 10 in me, because we could do so much, and it really is a powerful shift in the paradigm. The fact that Toby Cosgrove, who's the head of this Cleveland Clinic, has seen the future and understands that this is the future of treating chronic disease, and has brought it not into periphery as an add-on to their services, but really into the center. In fact, we are literally in the heart of Cleveland Clinic. We are in the main building, right in the heart, and we've grown so fast that we have 1,500 people on the waiting list. Last week I saw 4 doctors in my practice, 2 deans of medical school, 2 chairmen of the departments, they are the institutes that are coming to see me as patients. So when the deans of medical schools and the heads of institutes from major centers are starting to understand that they need help, they're actually asking for care from functional medicine, then we're seeing real changes.
Yeah, that's exactly been my experience on a smaller scale, definitely. But I would say 20 to 30% of my patients are physicians or healthcare practitioners from the conventional model. They're athletes and people who are really in prominent positions in many different fields who are becoming aware of this work, and it makes sense to them. It's kind of a no-brainer, really. Yeah,
it's really true.
So this is kind of a little bit of a tangent, but I'm a research nerd, as you know, so I think about these things. The functional medicine, one of the principles is it's individualized, right? We don't necessarily give the same treatment to the same patient, even if they have the same condition, because we know that one person with depression could be an inflammatory disorder, but another person, it may actually be more situational and related to what's happening in their life, or maybe it's related to gut-brain connection and gut microbiota, So when you're designing a study to test functional medicine, how do you take those individual differences into account? Or are we at the point where we can't really do that yet, and we're just, it's one step at a time?
No, I think we absolutely can and do. This is what we do as practitioners of functional medicine. We treat everybody differently based on what their problem is. And so, I always give the example of depression. If someone comes in and they're hopeless and they're helpless and they have no interest in daily life or sex, or they don't want to eat or can't sleep, we go, well, you have depression. Well, that's just a name that we give people who have those symptoms. But then we can figure out what the cause is for each person. In one person, it may be because they're eating gluten and have developed an autoimmune thyroid condition called Hashimoto's. Another person, they may need thyroid replacement. Another person may be because they have been taking an acid blocker for 10 years and have B12 deficiency, or because they have vitamin D deficiency from living in the Northwest, or it's winter, or because they have taken antibiotics, which alter their gut flora and create inflammation, or because they eat sushi and have mercury poisoning, or hate fish and have omega-3 deficiency, or maybe eat a lot of sugar and have prediabetes. In each one of those patients, you need to figure out what their issue is that's causing their depression. It's not like everybody gets an antidepressant. You have to figure out an individual personalized approach to every patient.
Right. So how do you approach that in research? That's what I'm wondering. Like,
how do you approach it in research?
Yeah, like if you're doing research on functional medicine.
So what we're doing is we're in our studies, what we're designing is we're studying the approach. Mm-hmm. So we're studying the approach, not a particular therapy. So I'm not saying, well, let's study CoQ10 in X, or let's study this diet in this. We're actually saying, everybody who comes in is going to get a personalized evaluation, personalized diagnostics, and based on what we find, we're going to customize the treatment. Mm-hmm. And it's sort of like a black box. They're going to come into the box, they're going to get treated, they're going to go out, and then we see who gets better.
Right.
And then, people go, well, how do you know what worked and what's going on, and like, how do you prove it? And the truth is that we won't know exactly what it is. We're just testing the method, and then we can go back and start to look at mechanisms and what's working and what's affecting it. And so I think it's really the approach.
Is there a control group that gets standard care for that? Or at this point, is it just testing the functional method?
Well, we're testing the approach and looking at how these different approaches compared to conventional therapy work or not. So we're going to take people with an autoimmune disease or with migraine or diabetes, and we're going to randomize them to either conventional approach or functional medicine. And then we're going to see how we do.
Well, see, that makes perfect sense to me because, and this is where I think the whole RCT thing has gotten a little out of control. I mean, it's been a tremendous development in research, and it's really changed medicine in a lot of positive ways. But when it comes down to it, patients have a choice to make in terms of what kind of care they get, right? They can either get, go see a functional medicine doctor, or they can see a conventional doctor. And that's really what it boils down to. So in the end, it doesn't matter as much whether it was this intervention or that intervention that made the difference in the functional approach, because the decision that they have to make is, and the decision that from a public policy perspective that needs to be made is, what is the model of medicine that's going to produce the best results. So
exactly. And then we can dig into, what the issues are or what we want to do. But I think it's really, it's really important to get the initial comparison and saying, what are the benefits? And what we're looking at are what I call the holy shit studies instead of the so what studies. In other words, it's not like, oh, well, you got a person a little better. It's like, oh, you fixed a problem that nobody else can fix.
Right, that we're spending hundreds of billions a year treating.
So we're taking people and getting them off insulin. That just doesn't happen, right? In medicine, people get progressively more medications. We manage their diabetes. We don't fix their diabetes. With migraines, we manage their condition, and we often there are patients who are very resistant to treatment, and we're going to take the hardest cases, who are the ones that no one else really would want to do, and that's a problem.
Yeah. I think that's right, because the RCT model is, in some ways, it's antithetical to individualized care, because it's trying to remove everything from the process except for the explicit effects of a particular intervention in a group of people.
Right.
And in fact, placebo, which is really the more accurate way of talking about placebo, is the sum total of the effects of the interaction that happens between the clinician and the patient. And up until the advent of randomized clinical trials, that was seen as something to be celebrated and encouraged, and a crucial part of medicine. And in some ways, RCTs have made that kind of a bad word, as if we can remove ourselves as clinicians from the interaction with the patient.
Right. Of course, it's not a bad thing.
So it's really cool to hear what you're doing there, Mark. It's inspiring, and I'm so glad to know that this is happening. I mean, a lot has changed just even in the past few years since
it's unbelievable.
Yeah, it's really exciting. So what future developments in medicine or the delivery of care are you most excited about at this point? Like, when you look, if we have a crystal ball, I mean, so much has changed, as we just said, in the last 5 years. Let's say we're having this conversation 5 years from now. What do you think we'll be looking back on and celebrating and talking about?
What's exciting to me, Chris, is I think that we're going to rethink not just what we're doing, but how we're doing it, the delivery of care. And I think one of the challenges is that we have very centralized top-down medicine. And that I call it the Uber. What's the Uberization of medicine look like? How do we connect together information, people, services, products that empower people to take things into their own hands, and what we call disrupt or disintermediate the medical profession? And we see this with Airbnb. We're cutting out the middleman, right?
Yeah.
We're cutting out and there's an access issue, and I think we can do that with scalable solutions. So I can imagine a future where functional medicine is built into a bioinformatics system, which analyzes your history, medical history, analyzes lab tests that be done it by yourself at a local pharmacy or anywhere, or maybe a kit that's sent to your home. That data gets put into a system. It's driven through an artificial intelligence decision support system. It spits out guidelines and recommendations for you to do. You find other people to do it within community. You learn how to actually connect the resources that are around you, that link everything together. I mean, Uber didn't invent anything new. It just linked together all sorts of resources to make things easy. And that can happen in medicine to help people change their lifestyle and behavior, to link with people in the community who want to get healthy together, to learn how to shop and cook and do all kinds of things. And I think we're going to see, a future of healthcare without walls. We're going to see, folks like you and I only dealing with tertiary care, really very severe problems that require a different level of expertise, that most problems will be able to dealt with by people by themselves at home without healthcare providers or maybe health coaches, or maybe online groups, or what's the Facebook of healthcare. So I think that's where I think we're going. That's going to change the face of medicine. And I think functional medicine is the operating system that can drive that, so that people get the most powerful change in their biology.
Yeah, that's really exciting. And I mean, less people think that this is a totally sci-fi, unrealistic vision. I mean, I've seen research showing that apps where you take a picture of skin lesion or rash and upload it to this database are more accurate in diagnosing correctly the skin problem than going to a dermatologist in some cases.
Yeah.
So, I mean, I don't think we're very far away from many of the things that you just talked about.
Exactly. No, we're not.
And
and then maybe it'll be linked to telemedicine, where people can link to you and I via telemedicine, and we can do a consult and guide them, and makes it super easy. Yeah.
And that, as you alluded to earlier, will hopefully solve the access issue, which is, for right now, functional medicine, at least in a kind of private one-on-one scenario, is really only for, upper middle class people and above. So, we're looking at offering group visits, both in person and video, using, video conferencing software, and integrating some of these algorithms and delivering content, from the ebooks and audio and video that can complement the courses. So it's exciting. Yeah. It's exciting to see what's possible. And I think not only in our lifetimes, but really in the next 5 to 10 years, we could see this stuff really make a huge dent in how things are done.
It's pretty exciting. Pretty exciting.
So speaking of exciting, you just published a new book 2 days ago, I think, and it is book number 10? Is that right?
No, actually, it's like 13.
13? Wow. That's amazing. I can't keep up. So
maybe it's 12. I don't know. Because I can't count.
This book is all about fat. So what made you decide to write about fat?
Well, I've been telling the sugar story for a while, and then I realized, it's pretty clear that we now know that sugar is the driver of most chronic disease, but no one's really told the story of fat, which is when you stop eating sugar, what do you eat? Well, you have to eat something, and you can't just eat steak all day long. You need fat.
Some of my listeners might beg to differ.
I think, well, by the way, for those of you who don't know this, when you eat too much protein, it actually turns to sugar in your body through a process called gluconeogenesis. So it actually can spike insulin and do all the things if you're eating excess amount of protein. But that's another story. But I think,
that's the next book.
That's the next one. But I think, I realized that no one really kind of dug into the slippery science of fat and separated what I say fat from fiction, and actually kind of helped us emerge from this low-fat craze that we've been in for 35 years. That's caused this epidemic of obesity and diabetes. So I decided to tackle fat. And it's the most difficult book I've written because the controversies are so deep and the paradigm shift is so big but I felt that I really needed to go into it. And the book is really a detailed analysis of the science of how we got in this mess, what we know about fat today, and blowing up two of the biggest myths, which is that fat makes you fat and that fat causes heart disease. Mm-hmm. And then it lays out a step-by-step program for people to learn how to include the right fats in their diet, how to increase fat without, getting into trouble, for example, like eating refined omega-6 oils or having trans fats, and actually eating a diet that is overall well-balanced and healthy.
So I know that, if I look back at just even 5 years ago, some of my beliefs about food and nutrition have changed significantly since then. And I hope they continue to change because it means I'm still learning and growing. I know that in the past, you maybe leaned more towards a lower fat kind of approach. And I'm just curious how your transition to this, maybe it's not so new for you, but maybe for some people that in the past were familiar with your work, how that's been received, by some of your colleagues in the lower fat, plant-based world and what that's been like for you. I'm just curious.
Well, I wrote Ultra Prevention 15 years ago. And then in that book, I wrote fat is not a 4-letter word because it was becoming clear even then in the heyday of the low fat era that there was benefits to fat and that we shouldn't all be low fat. So I've been talking about this for a long time, although, my thinking has evolved and I realized that, I thought saturated fat was evil. And now I realize that, based on the science, I don't think it's so bad. And I don't know if it's a health food, but I think, if I had to choose between butter and a bagel, I would definitely choose the butter where I used to choose the bagel. Yeah. And I think that's really shifted for me. I used to be a vegetarian. I used to eat low fat. I used to eat a ton of pasta. I thought pasta was a health food. Yeah. And I think, when I look at my own health and my own body, it's just stunning to see the difference. I just sort of amazed. Like I see pictures of myself when I was in my 30s and what my body looked like, and I was more flabby and just not as fit. And now with less exercise, I actually am more muscular, have more levels of fitness than I did. It's pretty fascinating to see what happens. And I lost 15 pounds and my waist size went down 2 inches. I feel more fit and lean at 56 than I did, when I was younger. And I thought I was eating a healthy diet. It wasn't like I was eating junk food. I never had soda. I never had processed food. I never had junk food. I ate tons of fruits and vegetables, but I did tend to eat more, more starches and more refined carbs and more pasta and more rice and more whole grains and more beans. And I think that, now I do not eat any of those things. Like, in other words, I sort of joke about something called the Pegan diet because I was once on a panel with my friend Joel Kahn, who's a vegetarian cardiologist and a vegan, and my friend Frank Lipman, who's a doctor who's on the paleo end. And I'm like, well, I'm in the middle here. I must be a Pegan. And I sort of joked about it. And then I began to think, what is a Pegan? And what are the principles that are in common? In fact, I realized there's a lot of principles that are in common between vegans and paleo if they just got to stop for a minute and stop being religious and start being curious. Yeah. And I think that, the concepts of a very low glycemic diet, of an unprocessed whole foods diet, of a diet rich in fruits and vegetables that are colorful and full of antioxidants, a diet that's low in antibiotics, hormones, or pesticides. It does not GMO, a diet that's absent of artificial sweeteners, additives, ingredients, a diet that is actually higher in good quality fats, a diet that is very, very low glycemic. These are standard principles. Even a diet that's not having any dairy in it are common to both. And having good quality proteins, whether they're plant-based or animal-based, that's the biggest difference. So I think, and then grains, I think there's a view, my perspective is that some amount of grains can be okay for some people. And I think gluten grains are probably the least healthy. And I think if you have things like buckwheat or quinoa or teff or other things that are what I call funny foods, they actually can be okay for some people. So I think we really have to look at, what's a person's individual health issue, what's their genetics. And there's a whole field of nutrigenetics. And you and I, Chris, have talked about this, that there isn't a one size fits all. And some people need more or less fat. And we're now beginning to understand how that might work. And so I think it's really just, being curious, not religious about the whole thing.
Yeah. And eating real food. That's so much of it, what it comes down to. And I know we shared a few meals together, and we eat. If you looked at both of our plates, you'd have a hard time knowing who is the quote paleo guy and who was the, who was the other guy. It's there's a lot of people want to make it into a black and white thing, and it's really not. Mm-hmm. So was there anything in the process of researching and writing the book that just totally surprised you? You weren't expecting, it was kind of out of left field, or was it, because you just did the Fat Summit, a couple months back, and you had people from all over the spectrum talking about fat. So, there's probably you really put yourself in that position of being in the middle, like the mediator. So I'm curious, what out of all this, and this is what you do, it seems like when you get into a topic, you really dive deeply and look at all the different sides of it. So I'm just curious to know if there, anything that came out of that experience that's worth sharing.
Well, I try not to have a preconceived notion of things and just try to listen to perspectives and combine that with common sense and some sense of just like what I call the sniff test, does this actually make sense? If we're being told to eat, 20% of our calories is soybean oil, is that something we've done for millions of years, or has that just happened in the last 100 years? And if that's so, is that a good idea? Probably not. That's, what I call the sniff test. So I think the thing that really struck me as I began to do the research was, just how much fat we probably should be eating, and how, 40, 50, 60% fat diets actually can be very healthy and correct a lot of the problems that are affecting people, including weight gain and particularly metabolic syndrome or type 2 diabetes. Looking at the studies, I was sort of amazed to see how we can really impact those conditions through higher fat diets. I had a patient, she was like pre-diabetic, overweight, struggled to lose weight for years, had cholesterol 300, triglycerides of almost 300, 200 something, and we're just trying to eat, basically healthy whole foods diet. It just wasn't working. And I said, well, why don't we try, a ketogenic diet? Why don't we try like a 70% fat diet? Why don't you have coconut butter and grass-fed butter and saturated fats and just try it for 2 months and let's test your blood and see what happens. And she called me back. She's like, oh my God, Mark, my weight went down 20 pounds for the first time in 30 years. My cholesterol dropped 100 points. My triglycerides dropped 200 points. And I'm like, your cholesterol dropped 100 points having butter and coconut butter? Even for someone like me, I've been so indoctrinated, like the rest of us in this culture, that saturated fat causes abnormal cholesterol. And the other thing that kind of was shocking to me is that I thought that saturated fat was bad because it raised saturated fat in your blood, and that actually we know that high saturated fat levels in your blood are dangerous and cause heart disease. What really shocked me was learning that actually it's these sugar and refined carbs that cause your body to produce saturated fat in your liver. So it's not saturated fat that you eat that causes high levels of saturated fat in your blood, it's the carbs. That was a kind of an eye-opener for me. The other eye-opener was, that you can use high-fat diets to reverse fatty liver, which affects 90 million people, and that MCT oil, which is a derivative of coconut oil, that we can actually use that to reverse fatty liver, which is pretty amazing. So many things I learned. It was really eye-opening. And I write all about it in the book.
Yeah, which I highly recommend. It's nobody has really done this the way that you've done it so far, just to trace the history of it and talk about fat from the perspective of summarizing all of the most recent research and how it can help. I think it's a really balanced view on the topic, and that's not the super dogmatic approach that a lot of people take. There's tons of books about ketogenic and low carb diets. There's tons of books about low fat diet. But for someone who just wants to get a kind of rational, well-researched, balanced view on the role of fat in a diet, I can't recommend this book highly enough. And if you've ever read any of Mark's other books, you know what you're going to be in for. They're always very well written and super practical and easy to implement. So definitely get out there and check it out. Mark, thanks so much for coming on the show. It's been a pleasure to talk to you. And thank you for all of your contributions to functional medicine and moving this forward. I know, as a practitioner myself, it's really exciting and inspiring to see what you're doing and to know that we're part of this movement and really transforming the way that healthcare is delivered.
Well, thank you, Chris. It's been amazing to follow you as well. I think you're one of the few people out there who are really digging into the research, are thoughtful, and report on in ways that are clear, accessible. And I personally learned a lot from you. So thank you for what you do too.
I appreciate that, Mark. And I look forward to seeing you, our paths crossing again, and at the next, whenever that happens. And good luck with the book. And let's do this again soon.
Okay, Chris, thank you so much.
All right, take care. That's the end of this episode of Revolution Health Radio. If you appreciate the show and want to help me create a healthier and happier world, please head over to iTunes and leave us a review. They really do make a difference. If you'd like to ask a question for me to answer on a future episode, you can do that at chriskresser.com/podcast question. You can also leave a suggestion for someone you'd like me to interview there. If you're on social media, you can follow me at twitter.com/chriskresser or facebook.com/chriskresser L.Ac. I post a lot of articles and research that I do throughout the week there that never makes it to the blog or podcast, so it's a great way to stay abreast of the latest developments. Thanks so much for listening. Talk to you next time.